All right, good afternoon, everyone. I still see a few people trickling in here, but we'll go ahead and get started, respecting your time, commencing right at 1 o'clock. I'm Brad Clark. I serve as Deputy General Counsel here at the Oklahoma Attorney General's Office. My colleague to my right, possibly your left, Christy Ice, also serves as Deputy General Counsel here at the office. And then a third colleague, Thomas Schneider, he's in the background today. He's under the weather, so he could not join us live, but he is here with us, and we'll go ahead and get started. Uh, Actually, before we get started, I want to recognize two other individuals who I think are joining us today. First, Terry Simonson. He is special counsel relating to this work for the Attorney General's Office, and Jessica Hawkins with the Oklahoma Healthy Minds Policy Initiative. They have been a great partner with us to date, and that will continue going forward. We'll talk about some of that work here shortly. If you have questions, please put those into the chat. Thomas is going to help monitor that for us while we go along. We will do our best to answer those at the very end. And if we do not have the answer for you at this time, we will certainly get back to you with the information we find shortly from here. So here are our goals for today. Just an overview. I'm going to take the first couple of minutes talking about the background. It's likely obvious whether you are in Podo, Bartlesville, Tulsa, Oklahoma City, Enid, anywhere in the state. This crisis has impacted your community, and not just impacted it, but greatly impacted communities in the state. We know that, but we thought we might take a moment to kind of set the tone for what the board wants to see around the state for implementing these grant awards. So we will go through some history, talk about the board's role, duties, functions, and then talk about how to apply and hopefully receive a grant award. And at the end, we'll back up, answer questions that you've had along the way. So let's start with the fact that I borrowed this slide from Jessica and the Healthy Minds Policy Initiative. I thought it was really well to illustrate the crisis. And so what they have said is, this is really in four waves over the last few decades. The first wave, we know that was with the oversupply of prescription opioids. When we saw, regulations were put in place to help stem the overprescribing, but shortly after that, we saw the second wave and a spike of heroin-related overdose deaths, and that started around 2010. Fast forward 4 years, we go to the third wave, and we see the appearance of these synthetic opioids. Mainly, we're talking about fentanyl and fentanyl analogs. That third wave is where we saw the most overdose deaths with those synthetics. Where are we right now? We are in the middle of this fourth wave. What we're talking about in the fourth wave here in the state of Oklahoma, we're talking about methamphetamine, excuse me, and really the co-use of meth and opioids, talking about fentanyl. These have caused a significant increase in overdose deaths in both substances. So backing up, since 1999, that first wave, we know that more than 1 million people in the U.S. have died from a drug overdose. In 2022, I think there were 48 million people who are identified as having a substance use disorder. And to a lesser extent than loss of human life, we know that this has a great financial impact. In fact, in 2017, the state of Oklahoma was said to have more than $10 billion in a financial impact through opioid use disorders. So what we saw, and we're still seeing, state and local governments, sometimes through their state attorney general, sued opioid manufacturers, distributors, and retailers. These have often resulted in what we're going to be talking about today, settlement awards that are distributed through, for instance, in Oklahoma, the Opioid Abatement Board. Again, borrowed this graph from, well, I guess originally the State Department of Health, but also in the Healthy Minds Policy Initiative's guidance document. I'm going to be referencing that document several times today. It's high quality and very informative. think this slide lays out over the last 15 years or so what we've been looking at in Oklahoma.
Okay, and so that brings us to kind of where we are right now. So the Opioid Abatement Board, which was created by statute, is responsible for authorizing the disbursements from the fund as grants to the eligible political subdivisions, which is why you all are all here. The statute requires an appeals process, which Brad's going to discuss in a little more detail towards the end of the presentation. The board is charged with oversight of the abatement funds and enforcement of any misspending. The link for the board website is included on this slide, and we will provide this presentation for all the attendees. So the next slide just looks at the funding available in the abatement fund. For this round of grant funding, there's $23 million available. And then with a little bit of money left over for reserve for the appeals. And then it just shows you the breakdown of which settlements and the legislative appropriation that are in the fund. And so then this is the timeline. I think as you all are aware, the letters of intent were due November 8th. The application launched December 22nd. Applications are due March 8th, which isn't that far away. We anticipate the award approvals and announcements to be held late April, and then rolling out the funding and hearing appeals late April and May of 2024. So everything is coming fast and furious. And then the authorized purposes, I know that's, you hear that a lot. And political subdivisions must spend the opioid abatement grant funds on approved purposes. And so the focus has to be on prevention, has to be on treatment, abatement, and response. And these two slides kind of lay out what those mean. And I won't read that in great detail. Again, the Healthy Minds Policy Initiative is a great resource to really look at what falls under the approved purposes. But grants must be used for evidence-based, forward-looking strategies, programs, or services used for the prevention, treatment, or other strategies concerning opioids. And the full list of approved purposes is listed on the application. You must indicate on your application which purpose or purposes align with your proposals. And then again, you can always go to our website and look at the Healthy Minds Policy Initiative for a lot of detail on those purposes. Give it back to Brad.
Got some issues with hearing, ladies and gentlemen.
Oh no, that's unfortunate. Give us one moment. We will pause briefly and see if we can rectify that.
Okay, several people are saying they can hear fine.
Okay, I see several people who have audio and can hear us okay. Is that continuing? All right, perfect. We will proceed. Sorry about that. Okay, we've talked about the history, the data, timelines, the board. Now let's jump into how you actually can get this money. You know that's where our focus is today, and rightfully so. You have to submit an application. That's the shortest way to say it. March 8th, that is due. You can submit it to the Office of the Attorney General either through email or mail it in to us. We will take either one. At that time, we will hand it over to an evaluation team, or shortly thereafter, I should say. Contents of the application. You all have probably looked at it at this point, hoping anyway. Contents. Yes, I see a question about where will we share this PowerPoint? Yes, we will. Contents of the application. This is a non-exhaustive list, but I'm going to highlight the first few points here. Out of the gate, we want to see the community's need. This is both narrative and with hard data. So the data points, we're going to want to see the per capita prescription rate in the community. We want to see the numbers per capita suffering from opioid use disorder, and also the number of individuals who have sustained an overdose death in the last 12 months. And then finally, that same last factor, but over the last 3 years. Again, that will be a narrative and a data point for the community's need. We want to also see the abatement plan. It should be thorough, detailed, and organized, but we want to see how you will be hopefully expending these funds over the course of the life of the grant. Financials and budget, that will include most recent audit and pertinent financial documents from the applicant. Key staff, who is anticipated to be working on this grant, and it might be a nice thing to have the resumes included as well, so the evaluation team can look at that sort of information. Also have to see evidence-based and evidence-informed documentation. Evidence-based, we're talking about a project that emphasizes practical application of findings to the research on opioid use disorders. And then evidence-informed, that's going to be a blend of research and practice. And then moving on to the next point, community support. We want to see what partnerships you have already existing in the community or that may be forthcoming with this project. And then finally, a set of assurances. Those are pretty straightforward. One of them includes that you did not use AI to complete the application. As I mentioned a moment ago, once the applications come in on March 8th, shortly after that period of time, they will be handed off to an evaluation team. And this is the rubric that they will use to score your application. You see the criteria on the left side and the points allocation totaling 100 there. How are you going to use those funds right out of the top all the way down to those community partnerships? Again, it's 100 points for this portion. And then we do have possible bonus points for a community that has not received any opioid settlement money. We are authorizing 5 bonus points for that community, and then on down the line there for a total possible maximum score of 130. So when we were looking at options for the grants, we know that, I'm just going to use this as an example, the resources in Tulsa compared to the resources in Oklahoma City are probably not the same. And that's also true. They're not the same in Oklahoma City as they are in Lawton, and Lawton is not the same as Woodward or Gotebo. And so we wanted to build an equity both in applicant size and by the category of the applicants. And so we have tiers for each applicant, and the awards will be based on both the category of the applicant. Are you a county? Are you a school district? Tech center? We'll go through each of those. And then on the right side, you see the maximum available funding for each of those tiers there. And then finally, as mentioned earlier, the statute establishing the abatement board does require an appeals process. And so the board, through administrative rules, has set up an appeals process for the following 3 options there: denials of funding for projects, denials of specific fund use requests. Sorry, I saw the comment about shout out to Gotebo, and yes, that is a shout out to Gotebo. And then finally, appeals can be based on denial of an application. The one thing that we will, or the board will not authorize an appeal to be based on is partial funding of a project. So, for example, you apply for $100,000 and only are awarded $85,000. That project will not be eligible for an appeal in that situation.
Okay, now we are getting into the questions. So these questions were either submitted via email, and we've heard them in various forms, or they were submitted via the Healthy Minds webinar. I will also remind you that there's an FAQ document on the opioid abatement webinar or website, and it has a lot of these questions in various forms. So how will the funds be distributed? They will be distributed in quarterly distributions. If you have a need to have funds distributed in a manner other than quarterly, you must indicate that on your application. The board can authorize a different distribution method. Are funds awarded on a reimbursement basis or on a forward funding basis? They will be awarded on forward funding basis. Matching funds are not required. And then, can a third party submit the grant? Yes, you can have a designated representative submit the grant, but you must provide the resolution that's required, and then I'm sorry, I got it off. The designated representative must provide an affirmation swearing and affirming that they are authorized to submit the application. So, are subgrants allowable? No. However, a grantee may contract for goods and/or services. The grantee remains responsible for any misspending on behalf of the person who they're subcontracting with. Then the term of the grant will be determined by the board. So you need to just indicate in your application how you need the term of the grant spelled out. But the Attorney General's staff will recommend a year, no shorter than a year. What are the reporting requirements? At a minimum, it will be quarterly. Grantees will be subject to random and periodic reporting requirements. And there is a 7-year retention requirement for any documents related to the grant. What drugs are considered opioids? You can refer to the Johns Hopkins Medicine Information on Opioids. You can find this on the Opioid Abatement Board website. Can applicants pay for costs incurred prior to the date of application? Yes, but only for abatement strategies, programs, and services that started on or before January 1, 2015. And there has been some indication by the legislature that they are in favor of forward-looking strategies. So keep that in mind when you are making your application. Political subdivisions can submit only one application, but you can apply or propose multiple projects in one application. And can subdivisions pool grant funds in support of a regional project? Yes, and partnerships are encouraged to maximize the impact of grant funds.
All right, I'll jump in here. Next question. Some of these are also in the FAQs that are on the Abatement Board's webpage. Question that we commonly get, is this a reoccurring yearly grant or is it a one-time grant? For this particular grant award, this is a one-time award. That said, an applicant may submit a multi-year proposal. So for example, you may propose, we need 6 months to get this off the ground. This is a new project. Once we get it off the ground and going, we estimate that we will need another year, year and a half, whatever the case may be, to fully implement the proposal. So that is an option. Not to say that the board is boxed in and has to grant that. It may choose to change it a little bit, but that is an option for an applicant. Can grant funds be used for salaries? Short answer is yes, possibly, likely, if they are, if the salaries are directly tied to abatement efforts. So the other way to say that is the use of funds is not tied to interdiction. So new squad cars, investigation, arrest activities, patrols, that would not be allowable. But if the position, the salary is used for treatment, education, prevention, criminal justice, that is allowable. All right, what about the purchase of xylazine test strips? Is that an allowable use of funds? Yes, definitely. Similar question, we received it in the context of the school nurse. Can we hire a school nurse for provision of services to students in the community with grant funds? Again, possibly, if not likely. Again, we want to see the use of the abatements fund that's directly tied to abatement efforts. And then finally on this slide, percentage of indirect costs that can be budgeted into a grant, that's 5% maximum. What about website development? Can an applicant propose to develop a website for purposes of connecting the public to treatment providers? An applicant can propose that, I suppose, but it will, in all likelihood, not be granted. And why do I say in all likelihood? I suggest there is an appeal process, but at this time, that is not an allowable strategy. And then what about the data? This is probably the biggest question we often get, and I understand why. The data and best practices, Healthy Minds put together a phenomenal document, a guidance document. I suggest all potential applicants go and study that document. the data sources and a lot of data themselves that are in there. We will, in the forthcoming slide, you'll see some resources with direct links to data sources as well. May have mentioned this earlier, questions and answers, including this entire PowerPoint, will be posted on the Opioid Abatement website just after this. If you want, submit questions to that email address there, oab@oag.ok.gov. And if you submit questions by February 23rd, we will post those on the website as well. And resources. Of course, the Abatement Board website at the oag.ok.gov, and then you can cycle to the Abatement Board. Healthy Minds, we've mentioned that. The Oklahoma Prevention Needs Assessment, also a valuable resource. Department of Mental Health and Substance Abuse Services has wonderful data dashboards there. Department of Health has others. And then finally, the National Association of Counties has a planning and principles toolkit. Suggest and recommend applicants go and look at those resources as well. So we're 20 minutes in.
Yeah.
And we want to value your time. We thought there would be quite a few questions. To the extent we rush through any of those slides, please ask a question. We'll take all your questions at this time.
We have a couple.
All right.
Question 1. Can you please explain the multi-applicant tier? If a city partners with a school, are they eligible only for the tier based on the population?
Thomas, can you lend an assist here? That's the example I was coming up with. A municipality and the school district partner together. I'm familiar with how we do public trust, but do you have the answer for that one?
Yeah, so I would recommend going with I would go with the city on that one, or whatever you're like. And we were also thinking, I think, about that in the sense of like the county and city model too. So go with the bigger grouping, and you may have students on the outside, but that is what we were kind of thinking about when we were developing that specifically.
Nice. Okay, thank you. Relating to public trust, I'm not sure if we have any public trusts on today, but if we do, the category or the tier that a public trust will be assigned is directly tied to the beneficiary of that public trust. And so if a public trust has a beneficiary that is a county, the applicant public trust will be assigned to the county applications.
Okay, they're coming in like wildfire. Is
All
there
right.
a set resolution that needs to be used for a political subdivision board to approve an abatement plan?
I don't know that we have a template resolution or other uh, similar governmental action. Um, I think they exist out there, but we have not developed one at this time. And to my knowledge, we don't have an intention to develop that.
Okay, next question. If a collaboration applicant did not submit a letter of intent, but one member of the collaboration did, will the grant be considered or do we need to wait for future rounds? Brad, I think I'll take this one. We'll
Perfect.
put a bookmark on that and we'll give you a answer uh, in our written questions and answers on that one. Just
And
to
I don't
go
know
ahead.
who the question comes from, but they might reach out to us offline. I know we had one come up today along those lines.
So, question 4, school resource officers' time spent doing prevention, would that be okay?
Again, I'll go back to that slide earlier. If it's directly tied to abatement efforts, yes. If it's tied to interdiction, patrol, those sorts of activities for law enforcement type of individuals, the answer would be no.
Okay, if a school, okay, school applies, do we use the school district population or community population? I would say the school district population.
Yeah, that's right. We're going to assign those based on, in the case of school districts, how many, excuse me, school district or students are enrolled in that school district.
Another question, Brad, can we use the grant fund for a narcotics officer?
That's possible. Just like the school resource officer situation, again, you're going to have to write the application in a way that really illustrates that this position, the funding of that position, is directly tied to abatement efforts.
What exactly is considered indirect cost for the 5%? Would marketing for educational community events fall under the guidance?
Yeah, I think so. That would be an example.
Would equipment for new staff person devoted completely to abatement, such as like a laptop, monitors, keyboard, data hotspot for field work, or cell phone stipend, would that be an allowable or authorized purpose?
Uh, I can see that within indirect costs.
And would drug testing by a school district be covered?
That goes down a number of trails when you talk about drug testing in schools. But um, so, are we talking about the strips that test or the Narcan? I'm not sure I fully understand it.
Whoever made that question, I'm sorry, I'm not able to attribute that to you, but if you could please go ahead and provide some more context to that, and I'm going to continue putting up questions.
Okay. Again,
Um,
if it's naloxone, Narcan, something to that effect, absolutely um, may reserve going any farther about drug testing in schools at this time.
so the next question is, you mentioned websites wouldn't likely be funded. Would other IT solutions that help identify who to outreach to for services and notify the provider to outreach to them for services be a possibility for funding?
I think the best way I can answer this question is it is possible. However, the board has been very clear, and I think they're right in this approach for whatever it matters about my opinion. We are looking to see sustainable and lasting impacts with grant awards. So if an applicant can, tell the story in a way that convinces that this use of funds is going to be sustainable and, um, you know, life-saving, leaving impacts within the community, we want to see that.
So the next question is, our county oversees and funds many programs such as early diversion, mental health court, adult and juvenile drug courts, as well as community sentencing. In relation to subawards not being available, would we still be eligible to apply for funding for these departments specifically, or would this account as a subaward?
So I don't know how much we've gotten into this detail. Subawards are not allowable, but subcontracts are allowable. The key difference that we see is that the money remains with the political subdivision and does not go out to a sub-grantee. Subcontracts are allowable, sub-grants are not.
Can you only request the population of the city, or can we count the county population to this from a city municipality? Brittany, could you help us out with your question? I'm sorry about that. We want to make sure we're answering it correctly. Um, Rhonda asked, so if the multi-applicant amount is higher than the city schools, should I use the multi-applicant amount? I would go with the highest of the two, because if the school is within the city, that more than likely is going to be encompassed with the city population amount. So that's how I would answer your question, Rhonda. And if I didn't answer it, please let us know. Brad or Christy, in regard to the education and prevention component, is that specific to just those impacted by opioids, or can it also be used to educate professionals who deal with opioid involved persons as continued education or certification?
Yeah,
Yeah.
that's allowable. Training for sure.
What if a collaborative application has multiple projects listed, but not all projects directly benefit both parties?
I don't understand.
Thomas, you want to take that one?
Um, that's going to be a rough one. You might give us a little bit more feedback, or we could take that question offline. I'm, our hope with a collaborative application is that they're going to be joint efforts by both parties, and they're going to have equal weight in the game, and skin in the game. So, just speaking from the perspective of somebody who might be on the initial review side or somebody who will be presenting these to the board, you would recommend that any collaborative application submitted, they have equal amounts of effort from both, all political subdivisions involved in the application. Hopefully, I did not bruise that answer, or just totally lose it. Okay, next question. You get this one, Brad or Christy. Can these funds be used to purchase items for contingency management treatment program for OUD? The current limit for Fed funds is $75 per year per client. Can we go beyond this limit since this is not federal dollars? Brad, I don't know that we're aware of that.
I think this is one where I'm just going to be candid and acknowledge my lack of knowledge on this issue. But this is one, if we can reach out, either the potential applicant reaches out to us, we reach out to them, and understand the issue a little better.
And Steve, I already copied that, and that is definitely going to go into our questions and answers document.
Thank you.
Does governance committee need to exist throughout the life of the grant or reporting requirements? It says unknown user. Yes, if the governance committee will be like the political subdivision, absolutely. We're going to need that school board or that school board, city council, city commission, or board of county commissioners to be exist throughout the life of the grant and reporting requirements. There is a provision in the rules and the statute in case there's an issue, that one subdivision can take over, but we have some constraints on that in rules, which will be online. So we'll follow up with you on that, but yes, we would hope so. And we're hoping that none of our counties, school districts, or our cities are encountering, bankruptcy issues. That would be bad. Xylazine test strip purchases. What do you think, Brad and Christy?
Yes, it's allowable.
So, Steve, to answer that question, we are saying that's allowable because xylazine and fentanyl are being used jointly. So we believe that is a allowable or authorized purpose. Unknown user, is there any willingness to push back the application deadline? We're hearing this more and more. We will definitely document this. We have it on the February 21st agenda for the Opioid Abatement Board. We heard you at the Healthy Minds Policy Initiative webinar. Saw a couple of comments, but now we know that that's coming up in this one, so we'll communicate that to the board. Okay. Susan, you ask, is indirect considered admin? Brad, what do you think? Or is it cost allocation pool expenses?
No, to me, that's admin.
Okay. They want to apply to fund these departments. Would this be available, or could these count as a subaward not allowable for us? So, Gabrielle, I think you asked the question about the mental health courts and stuff. what we want you to focus on is, if it's a contractor per se, and you're basically contracting with an outreach and they're providing goods or services in exchange for, the money, that's going to be allowable under the statute and rules that we promulgated. What's not okay is all the money leaving the political subdivisions of the county school district or city, and the county school district city not having ownership and monitoring over those funds. I hope that answers your question. So it's like a contract for goods or services. It's a contractor. Okay, so unknown user, are the approved purposes limited to those in the grant application? See items A through U, or will mediation uses listed in Exhibit E also qualify? Do you mean take that one, Brad?
Sure.
So the answer is we believe that most of what's under Exhibit E is going to fall under A through U under the Act, so the state law. Just in case we think there's a problem with that, we have a bill that has passed out of committee already. It's going to be amending the Political Subdivisions Opioid Abatement Grants Act, and it does actually incorporate any allowable uses under a settlement. So that will basically get folded in to approved uses. Okay, I'm going to let you guys answer some. If a city and county apply and the city is within the county, do you add the populations for tiering purposes?
So I think what we would do there is assign it to the county, that being I assume, the larger
Yeah.
population, and so just use the county.
Okay, Gabrielle said we answered it. Cassie, if a school partners with a nonprofit drug prevention coalition, would we, the school, be able to use the collaborative multi-applicant tier? The coalition did not submit a letter, but we work with them already.
So to me, that would be a situation where the school district is the applicant, and in the application, the school district informs the board that they will subcontract with that other entity.
Brittany asked, if our narcotics officers cross-deputize, can we claim the county population?
If the school district is the applicant, we'd
Yeah.
have to use the school district population.
Is that, sorry, I didn't hear who is
Oh.
the applicant in that situation.
I believe, I'm sorry, if we misunderstood the question, let us know. I
Yeah.
believe that she said it was the school
Okay.
district who was applying. It just happened to be the narcotics officer who would
Got it.
cross-deputized.
Sorry, folks, I was dying a little bit.
I wondered.
So, what site will be putting it on? This website is the only drug. Can you read that?
No, we're not able to see it.
Okay. Is the
Sorry.
only drug identification tool allowable is the test strips?
No, I don't think so. That's just one that is possible.
Do you have a list of approved trainings or training providers for staff focused on abatement? Can we send people to ODMH conferences and training?
That's possible. I don't know what specific trainings they have, but they certainly have some great resources, and so I assume that their trainings align with those resources. But I think that one's a little fact dependent. It's possible. I'll just say that.
If you have any more questions, keep them coming. We're going to keep answering them. Are agencies who did not send an initial letter of intent or initial interest letter able to apply?
Not on this round, but there will be more.
Harm reduction trainings, or Steve, can you spell out ODAZL? We're not familiar with that, but harm reduction trainings, I think, would probably be allowable under the approved uses, even under our statute.
Yeah, I agree. And in fact, a couple of slides we have talk about harm reduction being allowable use of funds.
Determination of service level. I mean that's going to get somebody into treatment, harm reduction. I mean it's definitely got its, its bearings and it's related.
Yep.
Rhonda asks, we have identified that transportation to treatment is a need in our community, is providing transportation an allowable expense. We believe it falls under harm reduction.
Um, just my take here. I don't know what the board would ultimately say on this, of course. I think that one is going to be interesting how it's described in the application. Just to back up, we said that interdiction efforts like patrolling, transportation are generally not allowable. Um, but again, depends on how the applicant describes that in the application.
So, Mr. Graham from Pontotoc Technology School, I think there was only like 4 of you that applied. So, great to see you here. Can tech schools enrollment be combined? High school students are like concurrently enrolled in full-time programs and short-time programs.
So before I answer that, I just want to make sure that I understand. We're talking about 2 tech centers, braiding or partnering in one application. In that instance,
No,
go ahead.
it's just like a technology center. They'll have students who take classes from surrounding high schools, and they're either enrolled in a full-time program at the tech school or they're in a short-time program. And so he's wanting to know whether or not they can use their total enrollment, including those students, in their population numbers.
I don't know if this is a helpful answer, but there is a report, a list that we have of total enrollments at tech centers and excuse me, traditional school districts, and so we will use the information on that report.
Got it. Brittany asked, I'm a city municipality, and if the county I'm located in doesn't apply, can the city claim the county population? Brittany, I'm so very sorry. That's going to be a no. And please remember that a lot of the counties that may not have that may not have applied, may actually be a litigating subdivision for one of the different settlements and may be getting money through a settlement that way, or they may have elected to participate in a settlement with the distributors or retailers, and so they will be getting money. So there are a lot of ways that people are getting money through the opioid abatement settlements. This is just one. This is the only grant-oriented one that the state is doing right now. So just thought I would give that kind of perspective for everybody. Okay, so I'm going to turn this back over to you guys from Desiree. She needs a clarification of the nonprofit and school question, please. If the school sent in the letter of intent and has a nonprofit embedded into their school system, can they then apply as a multi-tier applicant? Thank you.
No, I don't think so. I think in that situation, it's only going to be the school district that is able to apply.
Thank you. You indicate that there will be more opportunities. You know those dates. If we're unable to accomplish community involvement and assessment data before March 8th. Right now, we do not. I can tell you that we're making great inroads, Mr. Blackburn, with our friends at the legislature. They are demonstrating an intent and want to provide us more funds, but we are focused at the very moment of getting the money out that has been appropriated to us or given to us through the different, the Mallinckrodt settlement and the Purdue settlement, and then that appropriation. So we're really trying to get the first of the grants out, but they are demonstrating a willingness and an openness for future distributions. So my guess, if I'm a guessing man, would probably be in 2025. Okay, Mr. Barry, this is back to you, Brad and Christy. Recertification costs for licensed or certified staff, such as LPCs, LADCs, case managers, renewals, or CEU costs.
Again, this is one where I cannot say what the board will say. My guess is they will not suggest or approve that as a sustainable use of grant funds that will leave an impact on the community. An applicant can include that. I just don't know that that's what the board has in mind right now.
Okay, and then finally, Diana asks, will there be a statewide database compilation showing how many served in treatment, et cetera, from reporting agencies or grant recipients in the future related to opioid abatement?
Yeah, so that is one thing that we are actively exploring, a platform or a dashboard to show a number of different uh, data points or statistics from the use of grant funds. And again, that's just one small reason why it's important that these funds are used for direct abatement services. And so, yeah, I'll just leave that there, but that's a good question.
Another attendee asks, are the proposed funding maximums per proposal or per multi-year proposals request the max for each year in the budget?
Thomas, you want to take that one? Christy?
Yeah, so I think, and apologies if we weren't very clear, and maybe that's something we could clear up in our permanent rulemaking, but the whole idea of the tiers is this is going to be the maximum award for that subdivision, regardless of how many projects you have, regardless of how many years your project's going to be. It is going to be award based. We are hoping to set a term, and we are going to also uh, we're contemplating that there's a likelihood that there's going to need to be some carryover into a second term or into another year that can finish out the project. So that's how we would answer that one. I'm going to go ahead and answer the next. What is currently available in the opioid fund to disperse? The board has authorized back in August of 23, $23 million to disperse for this round of grants. Doesn't have to appropriate all 23 or disperse all 23 million, but that is what they're authorized to disperse. And then on to Mr. Barry again, and that is for you, Brad or Christy. I've asked about recent costs because it's difficult to recruit treatment staff to rural areas, and we are very underserved.
I'll jump in and take that one. This is an example of why context matters to me anyway. And so if Mr. Barry's community demonstrates a significant need for grant funds, and then, part of the application demonstrates the difficulties in recruiting staff, that's possible. And that context is very helpful.
And I might add, Brad, one thing that we did add to our rules to give flexibility, because I know that this was a concern for our for our board members, and that is, while you have the maximum in the tiers, if you want to go ahead and exceed that maximum, you can. But you're going to need to demonstrate extraordinary need. That will be in the rules, and we'll probably add that into the questions or add that to the FAQs to highlight that rule. But it may already be in the FAQs. But if you are going to, ask for more than what our maximum is, you will need to you'll need to show extraordinary need. We have also allowed the board, say we sent out, they voted on all the money and we still have leftover money from the 23 million. They have the ability to go through and award more if they believe, up and above those amounts. If they have leftover money and they believe there's demonstrated need. So we've given them some room to do some more work, if that makes sense to everybody. Okay, back to you. And Christy, will a portion of the funds be available for project oversight and reporting requirements?
I think that goes back to the 5% that can be used.
Steve, appreciate the efforts. Absolutely. We look forward to seeing your application, and so sorry that your area is being hard hit and underserved. Under unknown user, what are or where can we find the stipulations for requesting above the limit if we're an appropriate applicant with appropriate work plan and budget? That is going to be in the rules. Those were approved by the governor on Friday of last week, and we just got those approved today for publication in the Oklahoma Register. They are effective, but we will be posting those online hopefully today or next week.
I believe a version is online at
They are.
this point.
Yes, it is.
Okay. All right. I think, Thomas, you're pausing. Hopefully you're still with us on the other side there.
I am. I'm not, I'm not dying over here. So the next question comes from Calissa Sanders, and her question is, for collaborative applications, will each subdivision submit an application?
No, I think we just need one application.
Okay. She says thank you. Any other questions, folks? We've got about 5 minutes. The mentioned stipulations for the above limit request, those are going to be in the opioid emergency rules.
And those emergency rules are, the draft of them is posted right now on the Opioid Abatement website.
So it is, I think it's oag.ok.gov/opioid-abatement-board.
And the link is on this PowerPoint too, which I think,
Sorry.
Thomas, if we put this in the chat, will everybody have access to it?
That's what I'm doing right now.
Okay,
Oops.
look at you.
I am sometimes on my game. Okay. And it looks like somebody put that in there for us. So
Oh, thank you.
Thank you. All right. If there are no other questions, I see the numbers are starting to drop a little bit. We will respect your time and give you a great 5 to 6 minutes back that we had reserved. Appreciate this opportunity and connecting with you all today and going forward.
Yeah, and don't forget to submit questions to the email address And it's on the website also.
So take care. Have a good weekend.